Hello, everyone. Thank you very much, all honorable doctors and organizers and all members of this forum, and Dr. Joss for inviting me today. And I prepared a little presentation which will tell you where I want to tell you how we practice homeopathy in Canada, Ontario, in particularly where I work. And then I will also present you a couple of cases, which my cases, some of them cases of autism, and some of the in one case, if we will have time, that together with Dr. Joss we did for brain tumor of a child. So I will appreciate if you will give me a chance really to share my screen.
Yeah, please share more.
Okay. I just don't, 1 second. Share screen, 1 second. Where is my screen? Oops. Maybe I'm not doing it right. Okay, 1 second, 1 second. My screen is here, but I cannot share it by some reason. Oh, here it is. Okay, good. Wonderful. Okay. So I will start from my story for how I become a homeopath, because my story is quite typical for many homeopaths in Ontario who really didn't know about homeopathy much before some problems started in their family. Like in my case, my daughter had a couple of vaccinations when she was a child in her first year, and I started noticing that her behavior changed. So at that time, I realized that maybe she was slightly vaccine injured. It was not severe, but still was of concern me, and I started to look into solutions. And I started really to treat her with one of Toronto homeopaths. And during this treatment, I see a beauty of this method, but also I realized how many people may benefit from it. So what I started to do at that time, I started to talk about everyone, about how great it is. And I said, okay, I will not become a homeopath. At that time, I was not planning to become a homeopath. I was having a very successful career in science, which I will talk separately. But I wanted really to share my knowledge with other mothers and help them to grow, to raise their children without hydrocortisone creams, without antibiotics, without Tylenol, antibiotics, and so on. And in this my search, I found a book of George Vitsulka's Arts and Science of Homeopathy. And after reading this book, it's actually changed my world. I realized that everything I knew before was absolutely not sufficient. And since I was actually always a scientist and I was always wanted to go deeper and deeper, I decided to start from fundamentals, and then I started to read Organon. And I cannot say it was an easy read, but after I read Organon, it opened another world for me. So I decided that I need to start studying homeopathy, and I went to British Institute of Homeopathy and started really taking courses there. And also I was very brave at that time, and I started to treat minor elements of everyone who was around me with different traumas, colds, and I was actually quite successful with this little knowledge that I had. Then my passion becomes stronger and stronger, and it's that fact that I completely changed my career. So practically, I became a homeopath 20 years ago. 20 years ago, I started really to become a homeopath. And before that, I have actually a very successful career. I was working in a big Canadian corporation, and I was director of research and development. I was trained as a chemist and biochemist as before. And really, I had many degrees at that time. I had my master's degree in chemical science. I had master's degree in chemical engineering and business. Two of them were, one of them was from Moscow and two of them from Canada. And I really did not realize how homeopathy will change this my path, which was there. So, but when I start really to study homeopathy, I learned theory. And as I said, some minor ailments I was able to treat more or less better, but I realized that I cannot really go further until I will have good clinical training. And at that time, I start to have more questions than I had answers. And everything in this world happens for a reason. And one of my friends and colleagues, which I met before, told me, you have to go to India and you have to meet with Dr. Joss Isaac. And at that moment, I was actually in some kind of a very critical moment of my life. I had to decide, should I continue with my career? Because I was, in the morning, I was R&D director, and in the evening, I was still having patients. And I didn't know how should I do this. So at that moment, I decided that homeopathy is more important than anything else. And I left my job, and my job was really very well paid, and I was not sure where I'm going. So, but I still decided to go to India, and I just quit my job and I went to India. It was first, I went there to 10 days. I went to see Dr. Joss. There was a group there. I studied there. Again, it was probably another shock for me because lots of things I studied before was not exactly what I learned there. But from that moment, start to my journey as a better homeopath and better clinician. So, so for last 11 years, I was pursuing these studies. And during these 11 years, lots of things changed. I become a full-time homeopath. I'm not really practicing any other modalities. I work, I think, about maybe 50, 60, maybe hours a week, because I have lots of patients. During this time, we had a registration in Ontario. So before that, our profession was not licensed and registered. Now it's a fully licensed profession. So people who are not registered cannot be officially, should not be homeopaths. So I went through this registration and I was invited to become a lecturer and clinic supervisor in Ontario College. And also last year, I become a member and lecturer and also clinical supervisor of really another organization. It's kind of another forum, which was called Hotline. And this hotline was organized by a couple of doctors. And it was dedicated to treatment of COVID. And during this 10 months, this group, I think, treated about 2,000 people. And I was also part of this program, and it continues now as well. So, and I run my own practice. So just to say about you probably would be interested about what is the status of homeopathy in Ontario. So College of Homeopaths in Ontario was established in 2015. Before that, there was still lots of homeopaths, but we were kind of it was just a profession which was not recognized and not licensed. Now, from 2015, it became organized and licensed. College is not, what we mean college is not a school. It's really a regulation body. So it's telling us what we can do, what we cannot do. There is some restrictions were put on us. It's a good thing and a bad thing. Good thing is because we are more recognized. Bad thing, there are more restrictions. And but there is right now, and definitely we need to pay quite a sum of money to keep our license. So now it's about 600 homeopaths, licensed homeopaths in Ontario. And we have a couple of schools of homeopathy. One of them is, I just put two main ones. I think there are some smaller schools as well. One is called Ontario College of Homeopathic Medicine, where I also act as a lecturer and clinical supervisor, one of clinical supervisors, and another Canadian College of Homeopathic Medicine. Other homeopaths can study, and homeopathy is taught in Naturopathic College of Canada in Toronto. But there is limited number of lectures. So usually people who study there, not many of them become classical homeopaths. So in Canada, we have number of pharmacies producing single remedies and compounded remedies. We have big companies which is actually selling, most of them are in Montreal, they're big pharmacies. We have Boyron, that you can buy Boyron remedies in Canada, which is a European company. And there is also other association. Some of the remedies, our remedies have to be approved by Health Canada. And if some of the remedies are not approved, they're not supposed to be sold. And sometimes it's become very strange because, for example, strontium carbonicum and cannabis sativa are not allowed in Canada. So really, there are certain limitations that we have because of that. So what is usually scope of homeopathic practice in Ontario? What type of patients, conditions we treat, and our specifics of work? So first of all, because in Canada, we have, let's say, promotion of homeopathy. We are far from ability to promote homeopathy. From time to time, we can have even kind of a very negative press about that this is all not scientific and so on. So overall stance is that we allow you to practice, and we have to regulate you, but homeopathy is not scientific. So this is really what is happening. So people usually that coming to us are people who are either didn't get help from regular medicine, or some of them coming from the countries where, for example, from India or from Russia, where homeopathy is more popular, so they want to continue this treatment here. So definitely the biggest number of patients that we have are, at least in my practice, are children, because many mothers don't want really to give children lots of allopathic treatment. And another reason for it is that we have lots of kids with behavioral issues, ADD, and autistic spectrum. And especially for autistic spectrum, there is nothing that medical system can offer. So they are looking for other methods, including homeopathy. And definitely we have children with eczema, lots of childhood eczema, asthma, allergies, and also children that are constantly sick. We're living in a cold climate, and there are children who are sick all the time. So there is 14, 15 colds a year, which considered normal. And definitely parents are concerned because every cold is an ear infection, it's antibiotic, and finally they see the child is really losing appetite, getting sick, and so on. And we have lots of kids with neurological problems, such as tics, Tourette syndromes, and speech problems. A second big group of our patients are women, and it probably happens same all over the world. So of course they're coming with the child, then the women are coming, the mother is coming, and say, okay, let's talk about me as well. And biggest problem is with women, we have their emotional problems. And specifically, I see lots of panic attacks because of anxiety and depression. Some of these women are on antidepressants, some of them don't want to have antidepressants, some don't want to go to them, but it's the biggest one. And then other big group of people are migraines, sleep disorders, hypothyroidism. And definitely we have menopausal ailments and so on, and weight loss, it's another big one, which have to be a combination with diet. With the men's health, mostly what I see today are headaches, mostly it's attention headaches because really of the stress, sleep disorders, digestive issues in men, which is natural, and prostate enlargement. And in general, we have seen people with low immunity, allergies, digestive problems, and definitely different problems of post-allopathic, post-surgery, pre-dental, diabetes, high cholesterol, and so on. So overall type of our patients, that really the challenges that every homeopath in Canada see is huge allopathic medication suppression, because we see generations of people. It's not just the first generation. We see people who were already born from parents with allopathic suppression. And you could see how difficult sometimes become really to unwind it. It's not people that you can do it sometimes with a single remedy. This is where peeling the onion is getting extremely important method. Now I start to see people with even worse situation. It's kind of a complex systemic allergies, which started really antibiotics. A number of women came to me after they were having urinary infections, and after 2-3 urinary infections, they were getting remedies like ciprofloxacin or something from this line, and others one microbite, and they developed some kind of a almost systemic, as really their doctors were telling them, histamine resistance. So it's a very difficult and complex disease. You cannot even understand where to start, because anything you touch getting worse in some other area. It's very difficult to understand how to start to treating them, and definitely we need help in understanding it, because it's more and more of these people, because it's all mucous membranes are affected, and regular remedies, something Nux vomica or nitrofurantoin or anything that you actually try to prescribe, or forget about constitutional remedies, they react and they have aggravation. This woman sometimes cannot eat anything. They have maybe there are men as well, but I just have seen some women with it. They cannot eat almost nothing, some just few vegetables, because they react practically on everything. Then we definitely see overprescribed allopathic medication for all age group, and tapering off allopathic medication for homeopathic patients sometimes is very difficult, especially people from antidepressants. Another thing that we see a lot is cosmetic and dental procedures, which not only interfere, but they create like almost like a imprint. And many of these procedures were not really medically necessary. It was more kind of a beauty things. Like, for example, people with venous enlargement, they immediately getting laser treatment, and then after that it's become more difficult really to do anything, because it's become combination between natural and unnatural disease. Vaccinations, you know, especially now when there is this vaccination campaign, but problem is we cannot even talk with patients about it. Legally, we should not be talking, and we were warned about that. Vaccines and homeopathy has a different scope of practice, so homeopaths should avoid any mentioning even with this about patients, and definitely this is very difficult. And also we have some policies regarding physical examination, because of privacy of patient, because really homeopaths in Canada, even they will have medical education or being doctors in their country of origin, they are not considered doctors in Canada, so certain things cannot be done. So you need, and this has become also sometimes challenge, because you cannot see certain things which you're supposed to see. But at the same time, despite of all this, what we see really positive, it's actually growing interest in alternative medicine. It's not only in homeopathy, but any other areas of alternative medicine. And we have a very good support from people, from the patients, not from a medical establishment, but from the patient, because people are disappointed in allopathic treatment and so on. Also, Canada is very multicultural society. So we have people from all countries, and this kind of a cross multicultural, let's say, pollination, we could say, that like a collaboration and understanding. People hear about it, that people could say, okay, in my country, that's what we were using. So even Canadians or people from countries who didn't heard about homeopathy sometimes are interested to learn. And definitely we have these private educational centers, homeopathic colleges, and definitely internet and distant education right now is also helping to promote this. So these are kind of a very positive things. And unfortunate tendencies that we have, really, that since our patients are very complicated sometimes because of the things, because of this allopathic, and when our homeopaths don't have enough good clinical, I really want to stress again this word clinical again and again, experience. So more kind of understanding theoretical part, but they didn't know how to manage every case, how to observe, how to really see what really progress is. they start to deviate from Hahnemannian homeopathy because they say, okay, they want to do real classical homeopathy, but they don't know, sometimes they don't know how. So they started to say, okay, maybe I use here this complex, or maybe if I will give this remedy in the morning, because I have picture of this remedy here and of this remedy here, so maybe I will combine them. And it happens a lot, and definitely it's not bringing them good results and lots of disappointments. People are using combination remedies which are widely available. They are actually combination remedies you can buy in the supermarket. And people say, oh, I was using this for many years, and then you again cannot see good symptoms. And another trend which is also happening is that people overemphasize the emotional aspects. I'm talking about homeopaths or even some schools. Instead of really looking as a patient in a whole, right? But patient as a whole is not only his emotional and mental state, even his complaints are in this area. They start to become going deeper and deeper in these emotional aspects without even proper training, because sometimes people think that they understand other people's mind very good, but it's not happening. So they go away from a whole person, like understanding physical aspects, and go just pure emotional, and it become like some problems there as well. Okay, so in my opinion, what we need to have very good clinical education to meet people's interests in homeopathy. And we need to meet, because we have to understand that really when somebody is coming with you with a problem and you are able to resolve even their acute condition, because in my work, I work a lot with acutes. Some of our homeopaths really say we are not really acutes, are for medical doctor, and I will just deal with chronic. What I find out that you need to treat acutes, you need to be able to treat acutes and treat it fast and treat it efficient. And this is what I learned actually through my clinical studies. Then when you resolve this acute problem, people will stay with you, and they will be much more patient even in for treatment of a chronic case. So, but we need to teach people how to do it, and we need to do it with a good good education. So, and what should actually, in my opinion, good homeopathic education include? Because I believe that the worst thing that really all these years of suppression of homeopathy done, they made homeopathic education very uneven. People may have some kind of a certificate or diploma from maybe even reputable institution, but it's not equal. You know, people have, when somebody said, I went to homeopath, then you really look into prescription of a homeopath and they give 3 different remedies during the day, 5 times a day, or they give 10 pellets or lots of different things. So, and all of this is very, very far from a real Hahnemannian classical homeopathy. Even school was called, it's a classical school. I'm not talking about Toronto. I'm talking about generally in Toronto, our schools are in a way are better, but I have seen it from different places, right? So we need also to really to teach people materia medica through clinical practice, because in materia medica, lots of things are written just in a very short sentence, but you really need to know what does it mean, how these words are manifested in the patient. Also, case management. Case management should be done with emphasis of homeopathical philosophy. It's also very important, because sometimes I think that our theoretical base is one and then clinic is separate. We have to do these things to teach people in every clinical step, really understand why you're doing this. And so we need to continue learning how to approach this treating of patients with multiple pathologies that were suppressing for decades, even for generations. And it's not always possible to remove it just with simple like arsenicum or nux vomica. I think it's getting more and more complicated, and we need to understand these approaches and learn together about it. Then also practical knowledge of miasm theory, because miasms is very important, and also I think excuse me, overused topic, because some places we know there are 3 basic miasms. Then people say it's 5 miasms, 7 miasms. Then people say, okay, we have right now allergy miasm, we have a COVID miasm. So, and you know, every of these theories become very popular because it's interesting. So I think we need teachers also who are good, experienced clinical homeopaths, and we need to have, because now internet is giving us, and all these platforms are giving us ability to do this. We need to bring our clinics closer to practitioners. So I will just tell you a little bit more about what helped me a lot, and to really say about Academy of Dr. Jose Isaac, which we met in Kerala. And I think I can say it not only from me, but from all my colleagues, because we have a big group, which I think first year it was 7 people. Now, I don't even believe maybe 40, 50 people only in Kerala who was coming. This is one of the photos, I think, from 2019. We have people from 11 countries, and it was more than 15 medical professions of people that are coming every year. And actually, I was also kind of a privilege to be not only a student, but also an interpreter there. So I'm just sitting there near doctor and try, because I'm fluent in English and also Russian language. So I was very happy to be a bridge between them. And I think we also now, for the last 2 years, we have a group which is, in addition to what we are studying there in class, we are meeting once a week also online and discussing certain topics. And it's mostly discussion of our cases and difficult cases. And it's also, it's like a club, and we, and lots of people are studying both from each other as well. And also for last 9 years, Dr. Jos was coming and giving us 3-4 day seminars in Toronto on different clinical topics. And again, it started first year maybe from 7 people, and then again we have as many people as room will allow us. Every year number of people are larger, and last year there was maybe first year that we didn't have it. It was last year because of the COVID restrictions. And again, we do meetings actually in between. So there was a group of people who were asking me to come and really maybe mentor them about some of the areas that since I was more experienced, and we were discussing it. So people have really thirst for good knowledge. Our practitioners want to have a good practical knowledge. So what was so special? First of all, I would say practice and clinic were 2 main words which were there, because philosophy and materia medica and organon, we have seen he was explaining us and really illustrating us on cases that we have seen and showing us the most important things. Also in his clinic, we were able to see follow-ups observations. Very often when we go to seminars, we see like kind of a brilliant case taking for 3 hours, case taking, and then some very interesting remedy was prescribed, but we don't know what happened after, almost never. Here we were able to see what happens in a week, because we were staying there for a couple of weeks, what happens with a patient in a week, what happens in a patient in 2 weeks, sometimes what happens with a patient in 2-3 years. I remember there was one absolutely stunning case of glioblastoma of a woman, and I think we have seen catamnesis or heard catamnesis of this woman already for, I believe, 9 years. This gives you really, really very good confidence in a method. When someone who had actually glioblastoma, operated but still growing, was cured from this practically absolutely deadly disease. And then after that, got married, have a child, and no relapse already for all this time. So this is, I think this was amazing. And it's not only one case, there are many cases like this. Then for me, for example, was so important understanding symptoms and their description in materia medica. Then practicing forming totality in every complicated case. A relationship of the remedies for continuity of treatment. So what to do next? What should be our next step? So we got to here. So always good practical understanding of it. And definitely proper miasmatic approach for comprehensive understanding in 3 basic miasms and their clinical manifestation. And I just want to share with you a couple of things that was kind of changed my world and my way of prescription. This was actually this picture that was Dr. Joss was showing us, and really I add to it one more layer, which actually you can see here with a dotted line, because how we were taught in many schools, including George Vitsulkas Academy and many and other places, you have to find a constitutional remedy, you will give a constitutional remedy, and then things will resolve on its own. Beautiful. You can do it in acute disease, you can do it in a chronic disease, just find a constitution, put all symptoms together, and it will give you full totality, and everything would be good. Sounds good, but it never works for me, and it never worked for some of my colleagues. People just were really was not able to understand why it was happening. And I don't know, maybe we were doing something wrong, but this approach worked for me. I'm not saying that this was a wrong approach with constitutional remedy. I think it's probably for some people it worked. Maybe they're doing better job, but I'm telling that it never worked for me that way, how it was taught. So this layer system was very, very useful because we realized that every chronic disease, very often people are coming with you with some kind of acute manifestation, and you need to address it. And I will show even in my cases how I was doing it. And it was totally classical. It was looking for strange, rare, and peculiar symptoms in something that you see in front of you. I added here this dotted line thing on my own because I see we have also some kind of iatrogenic and environmental symptoms, which are not even symptoms. And if you look into really into works of Hahnemann, he said that this thing should not be even treated because this is not a disease, but this is something we see. And we need always to address this thing as well. This is also, I realize, this is a separate layer that you have to deal with. But going with this system step by step, and I'm not saying that in some situation, miasmatic, constitutional, chronic, and acute may be the same. It can be same tuya or same calcarea carbonica, but it's not always happening. And this is a difference. And another thing, which was actually kind of also was stressed in my mind, which I use a lot and even teach a lot, that disease is, to me, it's like a tree. And we know if you look at any tree, because we see tree of life, but there is also tree of disease. And usually what you see is a crown. Maybe sometimes you just see flowers of this disease, but really we need to deal with roots. And roots could be very different. And if roots are, like in this case, you see the tree which is on the stone. So the roots are probably not very deep. So this one you may actually take out with one shot, with one remedy, maybe 2 remedies. But what if you have this type of tree of the disease? Look at all these branches. So Dr. Joss was always telling them, and then actually I think these were words of Bellinghausen, which we almost forgot. Sometimes before trying to uproot the tree, you need to cut some branches. This was I was never taught in any other school. Because if you're not doing this tree can actually fall and bury you, and really you will not go very far with your patient. So this is something like at this moment, just I leave my I would say, theoretical part of it. And then now I would like to show you my practical applications of some of the cases. And I know that now COVID cases, I was thinking about what to talk about, maybe talk about my COVID cases which were treated successfully, but then I decided to talk about autism because I know that COVID is a very serious pandemic, but we have the silent pandemic of autism for many years. And I don't think it will go away, and it will definitely not go away with vaccines or something. So I had really quite a number of autistic cases in my practice because, first of all, these people really there is nothing could be done. Really, sometimes it's really nothing could be done with them. These families are suffering tremendously. We see even separations of parents because one of them, usually father, cannot deal with it. We see mothers who are almost in pre-suicidal state because they don't know what to do. There is no medications. There is no, they really can nothing to do. And another thing is that every autistic child is different. They say when you see when you see an autistic child, just have seen one autistic child because the next one would be different. And there was even this epidemics is going really very seriously. I remember when my daughter was born 21 years ago, they say already there is a huge increase in numbers, and it was 1 in 300. Now we have probably 1 in 30. And I'm not talking about children who are maybe not diagnosed, but they are behaving very strangely. So we have really disproportionately high amount of these children, and it's a geometric progression. And we don't have much experience in our literature about this. Maybe just some of them saying difficult child, like Roberts was writing, but not much was written. And when I started treating them, I was actually looking to the symptoms, and I was looking, okay, lack of eye contact, very hyperactive, very passive, lack of speech, flapping, lining the toys, in one line, food sensitivity, self-harming. And I was really looking for this type of symptoms and repertorizing them and finding a remedy, and it was not working. And I really realized that this is a kind of a common symptoms, and we need to look into every child, these special and common symptoms. And really, individual symptom of this child is not very easy to find because all of this, what I said before, they are so much overpowering. Because this is what parents are telling about flapping of the hands, about running around, swirling, and so on. But you have to find this uncommon between this common in their individual abilities, in their etiology, and in their miasmatic history. So why so difficult to treat autism? What are challenges we have in the treatment? First of all, it's a very deep miasmatic disease, which is affecting nervous system. And we know that nervous faculty and mind is the highest and most difficult ones. And treatment and unwinding all of these layers is a very lengthy process. When we are talking about peeling of the onion, it's a big onion to peel. And in majority of these children, you always see some type of digestive problems. It could be either constipation or diarrhea or some indigestive stool or smell from the mouth. They are not able really to digest normal foods. Not talking about even milk or gluten. It's majority of them cannot do it. But when they make like stool samples, it's really lots of disbalanced gut microflora. And many naturopaths, they give them lots of different supplements to do this. They give them enzymes, they give them probiotics, they give them vitamin B, because many of these children are vitamin deficient and mineral deficient, especially zinc and magnesium. And it still does not work very well, maybe a little bit, right? But we don't see, there's no like significant changes, because Very important, actually, one very important thing. Time is the essence here. If you start to treat these children around age of 3 years old or earlier, you have much better success, because I have seen a couple of children that came to me at age 7, and they spent many years in some naturopathic treatments. They were removing heavy metals. I'm not saying it's wrong. I'm just saying that I didn't see much difference. So a little bit, maybe they're a little bit calmer. They start to eat a little bit more, but in general, it's same things, right? And you see that these children, I don't know when they will become older, because I have some older autistic child, even not child, it's a man, 18 years old, who came to me at age 16. You can do something there as well, but it's minor in comparison to what you can do when the child is 3 years old. But that's what I said, that between 3 and 7, they were getting all this other treatment, not homeopathic, and it was not that successful, in my opinion. So, family, so these children, usually this naturopathic treatment are recommending very strict diets. So these children are already eating very limited number of foods, and you cannot, as a homeopath, to find any cravings or any aversions. So you don't know, because he never, for example, tried fried food. He never maybe tried salty foods. Salt is not on the table. So this also creates a little bit more difficult to find his general symptoms. Another problem with these children is really that they're distressed in the family, because parents not often can agree even on treatment. Parents cannot agree on treatment, because one of them saying, "Oh, we were told that it will never help, so why should we even spend time?" And things are not changing in 1 month. It could be pretty quickly, but not in 1 month. So family support is essential. My best cases I have in the families where parents were coming or contacting me monthly or once in 2 months, and really kept going. Whatever happens, they kept going. This was usually very good results. Another problem is that these children with severe cases rarely have any acutes. They don't have fevers, they don't have ear infections. So parents saying they're very healthy. In fact, it's opposite. They are not able to develop any inflammatory condition. When we start treating them homeopathically, they start to have fevers, which is very good sign. Or they may have some skin eruption, which is a very good sign. But for parents, it's really distress. My child was healthy, and now he is not healthy. And you need to talk to them, and you need to educate them, and when this child have a fever, you practically need to hold their hand, so to let them to go through this, because they have tremendous fear that something terrible would happen. And it's lots of work for practitioner. It's lots of hours of really dealing with them. So now I will talk about my first case. Not first case today, it's not my general first case. It's a boy we will call him MB. He was born in 2009, so now he's 11 years old. So when he was at 2 years and 9 months, he was really diagnosed with severe to moderate to severe autism. His receptive language, expressive language was below 1 percentile. So I would say this was a most severe autism as it should be. Lowest 1 percentile from really, so 99% of kids of his age were better than him. And parents said that, again, I will not go through all details because there is no time, and this is not a lecture, it's just a story, right? But I will just give you like an overview of how it was going. There would be no repertorization or much details because this is not a class. So regression started 21 months. He have no contact with the mom. He was practically ignoring her. By some reason, he had preferred contact with father or other men. He was toe walking, and I will show you that toe walking is a big symptom of autism right now. It's one of the big ones. He was spinning, hitting his head, and had lots of tantrums. So actually about this toe walking, now I notice a lot of toe walking with autistic children, and then I found there is an article saying that toe walking is have some connection with autism, because this is not a purely bad development of their foot. It's really more neurological symptom. So here, this boy was born by C-section. He refused breast from very beginning. At 6 weeks, mother realized that there is absence of eye contact. So he had never had an eye contact. Some people lose eye contact. This one never had it. He started to walk in 10 months. When he was 3 years old, he'd have no speech, some unintelligible sounds. Very early had skin rash, dry through the entire body. Digestion was never good, sour smell, slimy, undigested. Stool is sticky, difficult to wash off, foamy and acrid. Redness of anus because of acridity, rumbling before stool. Diarrhea was alternated with constipation, colic so strong that he was hitting his parents. And this was actually, his colics were extremely severe. And they were happening at night especially. And he was crying, but when parents come to see him, he was crying even more. The moment they were trying to touch him, he was crying even more. He was tremendously distressed during this time. He disliked to be touched or even looked at, especially when he was in pain. He was having hacking cough, not related to colds, which was probably related to some reflux. He was sweating at night. I managed to look into his tongue. It had a whitish blue coating, and he had a very rough skin, like with not typical children's skin. So his mom had a pregnancy which was late. She was still 43 years old. And from the beginning, she was on medication because her gastric ulcer became aggravated in the early pregnancy. I think she had also some thyroid problems. She was medicated. Before this child was born, she had 3 miscarriages with the same, it was her 3rd husband. And she was on she had issues with prolactin, so she was on the thyroid medication through entire time. And her previous history was also with children not good. One of her children from previous husbands, one had ADHD and another had scleroderma. When I took her husband, he kind of told me that he had STD when he was young, and mother history also have this scleroderma, eczema, hormonal imbalance. So very difficult multimiasmatic case. So I already don't remember how did I get to this idea, because I was thinking about definitely some digestive remedies, but whatever I was looking was not giving me a full picture. So then I started to look into what the most peculiar for me. For me, most peculiar was response of this child for a pain. He was so actively pushing everyone who tried to come or to see him or even touch him. Like it was putting him in such much distress. And when I look into his white tongue and gastric derangement and irritability and eczema with gastric problems, I at that moment started with remedy, which was antimonium crudum. And I gave him 1 pellet for a week for 1 month. It was interesting that it was just before I was really going to India in 2012. And then when I came and called mom, it was probably a little bit more than 1 month. She told me that he's actually better. He's more playful. Stool is still bad and I digested, but speech is better in what way? He was not talking, but his sounds were more, how to say, more look like childish sounds, because before it was a complete gibberish. Before she started to have sounds that usually children have when you're 1 year old, before they want to, before starting really to talk. She had less cough. At night he was restless, but not crying and not pushing. And he was better following instructions. So This was in March, and we continued with antimonium crudum, I think 200, and they say that this sounds bubbling is better, better contiguous, other less flapping or fixating. Skin was still very bad. Stool was very, very smelly and slimy. It was not any better, but I was really not paying much attention. I was thinking that in range of symptoms, my most important observations should be his mental state. And he was generally in much better mood. So I said, let's continue. Then something interesting happened. This child was on a playground, and she fell down, and his mom, who was also trying to study homeopathy, she gave him arnica 30. And interesting that after arnica, he had another leap of communication. And what I'm thinking about is that it's not that arnica was better remedy for him than antimonium crudum, is that any remedy that was given for certain thing on time would give you a good step. So this was a mechanical injury. And arnica was good for that time for him. It was very homeopathic probably for him. So, and it was another leap in communication. And what was interesting that 1 week after arnica, this child, first time in his life, in 3.5 years old, had fever. And fever was very much type of belladonna fever. So it was really high, it started very quickly, and he received belladonna 200. Also, he had some yellow cross. Mom, on his own, she gave him pulsatilla. But after that, he had another very big leap in his mental development. She called me and she said she cannot believe what's going on. She started to notice world around him. He responded well to presence of children. She wanted to play with them. Before, he was not having any of these symptoms. So there were some other things were happening in between, but really big, another thing in November, I think after that, antimonium crudum was not giving big changes. And I maybe even tried something and it was not working, but in November, they told me that his development is really going very well, but stool is very, very slight and smelly. So I said, okay, let's look into really symptoms here. And I prescribed him sulfur 30. And even from this 30, sulfur 30, which was given in November, he started talking, he started to have toilet training, and stool there was periods where stool was not as bad, so it was alternating, sometimes slimy, sometimes normal. He stopped complaining about his tummy aches, but during this time, his aggressiveness, as mom said, increased. But I was looking into this, it's not was really aggressiveness, it was he started to understand what bothers him. He started really to respond to world around him. And we start to give him sulfur from 200 to 10 and each potency was giving, we were slowly going through cancer, and every potency was giving us sleep and development. So after sulfur 10 she told me that she had a extremely smelly and some kind of almost like a tar looking stool for 3 days. Very sticky, terrible, with some smell of even some chemicals. She said she never was thinking that something could smell so bad, but it was finished. And since that time, his stool was normal and all his speech became normal, and autism over the years subsided. When I say subsided, really, he doesn't have autism, but he has some personality, which is sometimes can fixate it on certain things. This personality we cannot change, but this personality does not prevent him or his family to live normal. So, for example, if he wants to do something, he will do it, and he will do it extremely, extremely well. Because if he dance, he dances beautifully. If he sings amazingly. If he draw, he is drawing. He's actually was going to the art school, who were very difficult to get in. Over next years, he was receiving remedies based on his needs. For example, at one moment, he had a strong burst of lymphadenitis, and he was getting some remedies through stocks and tuberculinum. At one time, he had, I think, urinary infection, and he got medarrhinum. So all his miasms and all his layers were coming, but it was already treatment of all practically normal child. And definitely his mom was doing a great job in taking him for different courses and classes and doing everything that is necessary. So what we see here today, this guy is one of the future top figure skaters. So he is right now, he was an Ontario champion in figure skating, and then he was invited to practice or in United States. Now he's practicing there for potential Olympic reserve. So big leap there. He won some singing competition in Ontario. He got first place there. And only now he started, actually, when we're talking about his constitution, I was always thinking that it's a calcareous phosphoric constitution, but I was not really 100% sure. So only now his calcareous phosphoric constitution manifested itself. When he started to do figure skating, he developed certain things with his knees and his legs, and he received doses like treatment on calcareous phosphorica, and I think he's doing absolutely great. They called me from, I think in November, from Florida, and told me that he may have COVID, and his mom maybe have COVID, and he was given treatment, and in one day he was absolutely fine. So 1-2 days, his immune system is perfect, and everything started from, you see, a very sick child with a very big miasmatic history. I don't know how are we doing, because I have a couple of more cases, but I don't know. I think it's tell me, should I continue or we will have questions period now?
You can take a little more time, doctor.
Yeah. Okay. I want just to show you 2 more cases if it's
How long
interesting.
it will take? How long it will take?
Maybe 15-20 minutes, or you want to start? It's up to you. I'm ready for questions.
Dr. Joss Isaac, please come in.
Okay, you can take 10 minutes.
10
Okay.
minutes. Okay.
Okay, so maybe instead of these cases, I will show you a case which were taken. It's actually a case which we take together with Dr. Joss, and it was a case of a boy with a brain tumor. Okay, so this child, and I think you see his photo here on the screen. This child came to me when he was 4 years old, and his mom said that he had a flu-like symptoms and vomiting. And when I look at him first moment, I said, it's not just a flu, it's something else. So, and because if you even see on a photo, his head was not really straight. He was not holding his head well. He had some neurological symptoms, but she assured me that he was at neurologist like months ago, and he was in the hospital, and said it is just flu. And I look and say, no, it cannot be flu. So after 1 or 2 days of giving some symptomatic remedies, I said, this cannot be flu. This is something else, because I didn't like this permanent vomiting. It was just not vomiting from a cough, you know, like a Antimonium tartaricum type of vomiting. It was something more severe. So I insisted that they should go to the hospital, and we have an amazing hospital, which is supposed to be a very, very good hospital of sick kids. And what was I have seen with this child, when he came to my office, he was not able to stand straight on his legs. He was all the time falling. And but when he got to the hospital, he was not walking there. So nobody noticed that he's falling while walking. They just put him on a bed, and he was continuing vomiting. So they sent him to gastroenterology. Oops. 1 second, I'm going back. So they took him to gastroenterology, and he was continue vomiting for 3 weeks, and they say it's a gastric ulcer. And only after he started really to to vomit with, coffee ground type of mass, like with blood, they decided to do MRI. I don't know how it happened. It's usually a very good hospital, but things happen. So when really, when they did MRI, they found that he had a brain tumor, which was brainstem tumor. At that moment, this boy was already in a very, very bad condition. You could see a photo. Then if you would like to see later, I can see in what he was already, his vocal cords were paralyzed. He was not able to eat himself. He have already tracheostoma, and he was on in ICU on a ventilator. At that time, again, I was on my way to India, and I told Dr. Joss about this case. And at one moment, we were able actually to connect with a mom, and it was very bad connection with and only thing which we have seen at that moment was the video where he was in this machine breathing. At this time, there was a group of maybe 15 doctors which were with us at this moment, and all of them who were all, they say this guy would not have more than 1 week. Dr. Joss prescribed Carbovec 30C for 6 days. And really, in 6 days, his breathing became more normal. Little bit later, they were able to take him off machine for a couple of hours. So we continue with Carbovec. He was taking it every third day. And already on February 19th, approximately a month, he was off ventilator already for daytime. They confirmed paralysis of vocal cords, and his right side was totally paralyzed and so on. And we were continuing with Carbovec for some time. Then on March 7th, when the breathing became almost normal, we went to Calcarea carbonica 30 every 5 days. And just a second. And there was some improvement there, but the biggest complaint was vocal cord paralysis. And we went from Calcarea carbonica to Costim 30C. Then in April, Dr. Joss was in Toronto, and me and him visited Mattia, the boy, in a rehabilitation facility. And he was actually amazingly better. He was flying, moving his hands, not walking. During this time, he was on some chemotherapy drug, but doctors still didn't understand why he is progressing so well, because their prognosis was very, very, very negative. So after Counseling Society, he was taking for 1 month. His secretions increased, voice became louder. Again, he was really we go back to Calcarea carbonica, and he was developing very well. So I will not go through all these details, but all his neurological symptoms were getting better and better. And we were addressing some acute things, like, for example, urinary problems after chemotherapy, Cantaris 30, and then back to Calcarea carbonica. But then what happens? They gave him MRI to see the state of his brain. And because he got a sedative, after that, he had a huge, huge deterioration. And again, we had to address this deterioration with the remedies, and we were successful with it. Even in the beginning, we saw that we are losing him. So again, he got Causticum 30, and then we switched to Calcarea phosphorica 30. So just to make this thing shorter, because it's lots of time. So this boy, who was practically dying, now he is completely, his tracheostoma is removed. He was working with walker. Now he's not even working with walker. He gained normal weight and size. I can show some of his videos. The only symptoms remaining is some strabismus. He's going to a normal school. What's interesting is the tumor is not changed very much in size. Tumor continue to be it seemed to be reabsorbing, but it's not significantly less. But despite tumor, which is actually there, it's like tumor living its own life, but this boy is living separately. It's like his body completely adapted to this situation. And doctors definitely are concerned, and it's because they say the most important thing, the tumor got less, but clinically, this boy lived absolutely normal life. They don't continue homeopathy the way they should be, because doctors told them you need to find something that would reduce tumor, and they are trying different things. But I'm in touch with mom. I think she's planning to go back to homeopathy because other system also not reducing tumor, but boy is doing well. This is what I wanted really to share with you, because this is real miracle, because nobody really believed that it would be happening. So what I think we need as a community, we need classic clinical homeopathic education with strong clinical exposure. We need to unite around really classical Hahnemannian homeopathy, because it's proven success over 200 years. And we need to understand and address the existing challenges, which we see right now more probably in the Western world, but it will go everywhere, because pharmaceuticals become more and more aggressive and more spread all over the world. Even in your country, it may be not as strong as it now in Canada, but it's only a matter of time. We need to have a good collaboration with training with best homeopathic practitioners. And we need to have a big openness and discussion of cases in classes and in lectures, not to show us only successes. Celebration of success is very important, but we need to learn from our mistakes. And we need to really learn this, where is the mistake and what we learn from our mistakes. And definitely I see very big part of my work, and it's education of our patients. It's a grassroots support, like it's a grassroots support of grassroots of who support homeopathy. Thank you very much again for your patience, for listening to me, for inviting me, and thank you all for being supporters and promoters of homeopathy, which I like and value so much. And I will be happy to answer your questions if I would be able to. Thank you.